Welcome to SimplyRN Trivia, where we learn everything about clinical topics by quizzing it out. You'll get easy, medium, and hard questions, and I'll reveal the answer and a quick teaching point right after each one. Let's begin. What type of bacteria is C. difficile? Gram-positive. Is C. diff aerobic or anaerobic? Anaerobic. Does C. diff form capsules or spores? Spores. C. diff is a gram-positive anaerobic bacterium that is spore-forming and toxin-producing. Which toxins are responsible for the symptoms of C. difficile infection? Toxin A and toxin B. These toxins are released by C. difficile. They damage the intestinal mucosa and trigger inflammation and diarrhea. Which hand hygiene method is effective against C. difficile spores? Washing hands with soap and water. Alcohol-based sanitizers do not kill spores. Friction and rinsing are required. What type of precautions are required for a patient with C. difficile infection? Contact precaution. C. difficile requires contact isolation with disposable gowns and gloves, and single-use equipment such as disposable stethoscopes. When should C. difficile testing be considered? In patients with 3 or more unformed stools within 24 hours. Testing should only be performed on patients with unexplained diarrhea. Which stool test detects C. difficile colonization? GDH. GDH detects a common enzyme made by all C. difficile strains. A positive GDH indicated colonization of C. difficile, while EIA measures toxin A and B in the stool, which indicates the organism is actually producing toxin and causing symptoms. That's why many labs screen with GDH and confirm with toxin EIA. A patient's GDH and NAAT tests are positive. EIA is negative. What does this most likely indicate? Colonization without active toxin production. Again, a positive GDH confirms the colonization of C. difficile. A positive EIA test is required to confirm active infection. NAAT is another test that checks for colonization of C. difficile. What is the most common risk factor for C. difficile? Antibiotics. The most common risk factor for C. difficile infection is recent or current antibiotic use, especially broad-spectrum agents like clindamycin, fluoroquinolones, and 3rd/4th-generation cephalosporins. Antibiotics disrupt normal gut flora, creating a niche for C. diff to overgrow and produce toxin. What is the first-line antibiotic for an initial C. difficile infection? Fidaxomicin. Fidaxomicin is preferred for an initial C. difficile episode because it yields similar cure with lower recurrence. Fidaxomicin is prescribed as 200 milligrams by mouth twice daily for 10 days. How long should contact precaution be maintained for a C. difficile patient? Until diarrhea has resolved for at least 48 hours. C. difficile spores continue to shed until bowel patterns normalize. Which type of disinfectant must be used for cleaning rooms of C. difficile patients? Diluted bleach. Only sporicidal agents such as diluted bleach destroy hardy C. difficile spores on surfaces. How long can C. difficile spores survive on hospital surfaces if not properly disinfected? Up to 5 months. Which one is a complication of C. difficile? Toxic megacolon. Toxic megacolon is a life-threatening complication from severe C. difficile colitis when toxin-driven inflammation paralyzes the bowel and causes massive distension. It can quickly progress to perforation, peritonitis, and septic shock, requiring urgent management. What is a vancomycin tapered and pulsed regimen? A tapered and pulsed regimen is a course where oral vancomycin is given at full dose, then gradually tapered and finally given intermittently every 2 to 3 days to suppress residual spores while normal gut flora recover. A clinical response to C. difficile treatment is defined as resolution of diarrhea for at least how many hours after completing therapy? 48 hours. Nice work, team. This is how we learn, question by question. If this helped you learn, like, comment, and subscribe for more SimplyRN trivia, and I'll see you in the next round.